everyone, my name is Maria Medrano, and today I'll be talking about Down syndrome. This is a presentation for Intro to Speech Communication with the instructor, Dawn Taylor. The purpose of this presentation is for people that are not informed about Down syndrome enough and underestimate their potential and strengths to be more open about how people with Down syndrome are and how they can be around others just as any other person. People need to educate themselves more about their conditions and their strengths. They are just as any other person and should be treated equally in every circumstance or situation in life, either in a job or school. Down syndrome is a chromosomal condition, common genetic cause, chromosomal abnormality causing problems associated with intellectual disability and different facial physical appearance. Individuals with Down syndrome have a high risk of developing several medical conditions, also need of surgery during infancy, problems with speech and language, behavioral issues such as attention problems, obsessive compulsive behaviors, stubbornness, and tantrums. They also have a high risk at developing Alzheimer's disease adults around age 50 or 60. Some of the causes of Down syndrome, the most common form of Down syndrome is known as trisomy 21, which is a condition where the individual only has 47 chromosomes in each cell instead of 46. This is caused by an error in the cell division called non-disjunction. This leaves a sperm or egg cell and an extra copy of chromosome 21 before the conception or the fetus is born. It is mentioned by research that there is a 3% that the father is the most likely to be the one carrier of the rearranged chromosome 21, and there's a higher percent on the mother. She has a 12% of carrying that rearranged chromosome 21. So it will be mainly the mother's fault, but it's still not like a reason to be like blaming either or. It just happens. Some of the physical characteristics of Down syndrome can be short stature, intellectual disability, it's below average intelligence instead of life skills. They have a really low IQ. Difficulty thinking and understanding at times. Facial features, they might have their face slightly broader with a flatter nasal bridge, small mouth and ears, lower set on the head, and tops might fold over. Congenital heart disease, displacement of the tongue, hearing loss, thyroid disease, or vision disorder. Some of their strengths are that they are very friendly, they are very visual attentiveness, they are very kind, and they are very generous to others. They have the ability to get along with others very well. Is there a cure for Down syndrome? There is no cure yet to Down syndrome since it's a genetic abnormality. Research and scientists have advanced their research to improve, correct, or prevent Down syndrome, but there is nothing sure yet. Treatment, therapy, and self-care can help them live a well-productive life into adulthood. Also devices, because since they, one of their problems that they might have is that they have, they might lose their ear, ability, so they need like devices such as to be able to hear more or more clear. Also, early medical interventions help improve their quality of life, because when they're little babies they struggle more than other babies and they take longer to develop and learn more. They can benefit also from medical support, from speech therapy, physical therapy, special education at home or in school, and assistance in school as well. And the conclusion of Down syndrome is that many people with Down syndrome live independently or with help or support of living programs. they have jobs just like any other person. They can take care of their personal daily needs. They also have great social skills that help them live a happy, productive life. It is mainly recommended not to underestimate them. They also um, have a lot of potential and a lot of love, and we should love them just as any other person. It is very helpful to encourage them to play, interact, and explore in the community with others, and to be very open-minded about their condition and to educate ourselves about their condition as well, so we won't misjudge them or treat them differently. And these are some of the web pages that I found information. Does anybody have any questions? No. No, well, that was my presentation on Down syndrome. Thank you.